Hello, everyone, and welcome to the September Lunch and Learn. Thanks for joining us on your lunch break today. As always, please feel free to eat through this. I know I'll be having my snack through, so please do not hesitate from eating your lunch. Thanks for just spending this time with us. So for those that don't know, we have our in-person coalition meeting coming up in October. Please mark your calendars. This is our only in-person event that we have each year. It will be in Charlotte this year on October 29th, which is a Tuesday. We're hosting at the Duke Endowment. The Duke Endowment funds a big piece of our EarlyWell work, and we are just so excited to partner with them this year for this opportunity. Once I'm done sharing my screen, I will put the registration link in there as well. Space is limited. I know we're down to our last couple of slots, so please make sure that those get filled. For those new to EarlyWell, welcome. Thank you for joining us. Hopefully this isn't your first time hearing about us, but if it is, thank you. So EarlyWell is a statewide coalition of more than 300 now stakeholders from across the state. And we advocate for policies that help the social emotional health of our youngest residents, ages 0 to 8. I also wanted to make sure I've already forgotten that we queue in our interpretation services. So Flora, if you want to go ahead and take it away.
So sorry. Thank you so much. Just for us to start interpretation, we need you to assign us as interpreters. So I don't know who's going to be doing that, but just very briefly, when the interpretation services are activated, you will see a Zoom menu on the bottom of your screen, and just click on the globe and click English.
Flora, can you double check for us that now you're seeing that interpretation sign?
Hi there, this is William. I'm Flora's partner. You can see the interpretation has been turned on, but please do remember to assign us as interpreters so we can go into the function.
Awesome, thank you. We'll have Ari take care of that right now.
Thanks very much.
Yeah, of course. Thank you all. As we go through, again, just wanted to thank you all for being here and just being a part of EarlyWell. So wanted to make sure that we had time to introduce our organization that we have joining us today. So Voices for Utah's Children. So our two speakers want to give some brief introductions, some just remarks, and then we'll go ahead and switch those slides over.
Yeah, that's perfect. Hi, everyone. Thank you so much for having us today. We're excited to join y'all on your lunch break. My name is Siria Calvarez Valle, and I'm a senior policy analyst at Voices for Utah Children. I have been working on healthcare policies for over the past 6 years, and since the pandemic have focused as well on our immigrant family policies. And before that, did a lot of community organizing and supporting immigrant students. So really happy to be here and really happy to share about our journey. So I'll pass it over to Thais to also introduce herself.
Thank you, Syriac, and thank you, Hannah, again for the opportunity. Good afternoon, everyone. Thanks so much for spending your lunchtime with us. My name is Thais Rio. I'm also one of the policy analysts at Voices for Utah Children, also working on children's health policies and immigrant family policies. I've been at Voices for a little over a year now, and previously I worked as a legislative assistant at the Utah State Legislature, staffing different standing committees, and also before that did a lot of work in the immigrant rights space. So my background is often surrounded the intersections of policy advocacy and community. So very excited to be here with all of you today and share the work that we've done and the work that we're planning ahead.
Awesome. I'll go ahead and get started. So today we are going to be focused on our journey, of course, to cover all kids and the path we have ahead as we continue on in this work and as we continue into the next legislative session in 2025. We know that there will be continued conversations on Medicaid, on CHIP, on our program. And so we are, one, excited to continue on in this work, and two, really looking forward to using all of the things that we have learned over the past years to use them and to continue this work. So I'll be focusing my section on the journey to cover all kids in Utah. In 2023, as you all probably have heard from Hannah, Utah became one of the 12 states that covered children regardless of status. And as of September 3rd of 2024, this year, 1,613 children have been enrolled into our RCHIP program. However, our journey started more than 6 years ago. If we can move to the next slide, please. So I'll start with one back. Thank you. I'll start with the why and why we chose this path to cover all kids. So as you can see, Utah has consistently ranked low in covering kids, with 2019 having a rate of 8.3 uninsured kids. Utah's Medicaid and CHIP participation rate, in addition to that, have been consistently low, with recent figures showing Utah's participation rate at 79.4%, well short of the national average of 91.9%. So we have a lot of work that we had to do. Medicaid additionally plays a vital role for children and families in rural communities. I know you don't know Utah, but Paiute, San Juan, Garfield, Iron, and other rural counties have really high rates of children with Medicaid and CHIP in our state. And in addition to all of this, we've also ranked really low in covering Latino children. And again, these are some of the main reasons why we knew it was important to go on this journey and seek to cover 100% of our children. Next slide, please. So in addition to these factors, we also know that immigrant families often face other issues and barriers when it comes to being covered. Many of the issues faced by immigrant families affect Latino families more broadly, and unfortunately, the chilling effect, which was exacerbated under the Trump administration when proposed changes to the public charge rule and other anti-immigrant restrictions and enforcement measures led to eligible immigrant and Latino families to avoid using public benefits such as Medicaid and CHIP. We recognize that even if we address the participation issues and even if we addressed, ensuring that the programs are stable, some kids and some families would feel left out or be left out. And so in Utah, we have about 108,000 undocumented immigrants, which is approximately 3.2% of our state. And in our mixed status numbers, we have approximately 41,500 kids who are living with at least one undocumented parent. So next slide, please. So we started our campaign to 100% kids back in 2018, where we wanted to build a strong base of supporters that has now included hospitals, accountable care organizations, community-based organizations, and other government entities. From 2018 to 2020, we worked really hard to build up this support and really build up our coalition and research why these programs are not only important, but necessary to ensure that kids are healthy and have the opportunity to thrive. Other policies that we wanted to champion include increased outreach and enrollment efforts, 12-month continuous eligibility for our Medicaid program, and protecting coverage. Just as a side note, right before I started, we had started the ballot initiative, and right as the first year that I started, the ballot initiative for Medicaid expansion had passed. And so we knew it was super important to protect this new recent parent coverage and protect the programs and ensure that as we look to cover all kids, we also looked at the broader spectrum to ensure that we were hitting all of the different reasons why kids were uninsured or why we could ensure that this program would remain stable and would remain a program that met the needs of Utah kids and Utah families. Next slide, please. So this is kind of our journey from 2018 to 2024, where we're at now. And just to give a little bit of context, Utah has led on several pro-immigrant family policies over the past 2-3 decades, including being one of the states to provide in-state tuition to undocumented students in 2001, driving privilege cards in the early 2000s, and the late Senator Hatch championed both the DREAM Act and CHIP. So all of these different policies really showed that Utah has been a leader in the immigrant space, but also in the healthcare space. All of these policies also helped us as we were having these conversations on why this issue mattered to Utahns and why we should be a leader in this policy area. So from 2019 to 2021, we released a number of reports that captured the program costs, the savings, and the values of this program. For example, in 2020, we released a Smart Money report that showed how we saved $9 million by covering all kids. This cost estimate analysis drew from one done from Connecticut by Kelly Whitener and others at Georgetown Center for Children and Families. Just wanted to give a shout out to them because they have been such a amazing partner in this work and in our journey. So using all of this research, we began working with Senator Escamilla in 2021. She is a Latina and immigrant legislator who really cared about this issue beyond just the legislative session. It really hit close to home, and really she has been a champion for our immigrant families for a really long time. So we have been super grateful to have worked with her. So because of her over a decade of experience, she has gained a lot of respect and political credibility as a Democrat, and she used a lot of her leadership to ensure that our sponsors were also leaders in the majority party. And so during our second iteration, so we had 3 different iterations of this bill. The first one was introduced in 2021, the second one in 2022, and then our third bill in 2023. And unfortunately, during the 2021 and 2021 iterations, we were only able to pass it through the Senate, 1, because we ran out of time, and 2, because we needed more support in the House. And so during our second iteration in 2022, that's when we really learned how much more support we needed from those not only who understood policy and not only just because it's a conservative legislature, but really because we needed healthcare policy experts to really show why this program could be successful and could really make an impact to our children. Next slide, please. So in 2023, we worked with Senator Escamilla and Representative Dunnigan. He is an expert on healthcare policies, on health insurance, and really developed a more moderate approach to our third iteration of the bill. This included having a program that mirrored the CHIP program rather than having a CHIP and Medicaid program, 180-day residency requirements, proof of family income, and a restricted amount of $4.5 million for a 5-year pilot program. Our third iteration also included more support of our accountable care organizations and healthcare providers who really helped speak in favor of the legislation during the House Committee. Throughout the years, especially the third year, we worked really hard to build our legislative relationships, focus our efforts on the importance of healthcare for children and the impact of primary and preventative care, how it has its impact on long-term health, and really focused on the positive fiscal impact of the program that it would have, and how important this legislation was because it recognized not only these kids, but also became really important to compromise on this program and really show that the values that Utah holds and how we want it to be the family-friendly state that we have always believed in. And so we're really excited. And I also wanted to share this quote from one of our healthcare enrollment assisters. She said, "We are happy to see that thanks to the efforts to reach out to the immigrant community, we have found families that qualify for Medicaid that have never applied because they did not think that they would qualify for health insurance." And so this is really a testament of not only the work to cover all kids in terms of this legislation, but really the bigger picture, the broader picture of really wanting this program and the programs that we advocate for to support all children in our state. While this legislation, really impacts our immigrant families, we also know that it has made an impact all around for those that have qualified in the past but didn't know, like this example that this healthcare enrollment assister really shared. And so I also wanted to share and happy to send the links to our different reports that we worked on from 2019, 2020, and 2021 to outline the importance and the need for this legislation and our journey to 100% kids coverage that also included really passing and supporting continuous enrollment supporting outreach and enrollment efforts in 2021, which we're really happy about, and of course the Covering All Kids program. So with that, next slide. This is what our insurance looks like now. And again, really happy and really excited to have worked on this issue over the past 6 years. Know that while the journey was hard and took compromise and took time, it really has been so meaningful to see kids and families really benefit from this program and really support these immigrant families. And of course, really having built the different relationships that we now continue to hold on to as the programs continue to be talked about, and as different barriers and different issues come up. So with that, I'm going to pass it to Thais to talk a little bit more about the journey ahead that we have.
Awesome. Thank you so much, Syriac. Can we go to the next slide, please? Great. Thanks again for providing that great overview of the work that you've done these last 5 years. So I'm going to shift gears for a second now and discuss what's ahead for us here at Voices for Utah Children and how we will be incorporating, right, some of the lessons learned from these past 6 years and the lessons learned from this past legislative session into our continued advocacy for Utah children and their families. So I will begin by sharing a little bit about what happened this past legislative session and how we're preparing for the upcoming session, and then discuss the different community engagement events we've done these past 2 years and our commitments moving forward. Next slide, please. Thank you. Okay, so I want to talk about our 2024 legislative session and the fight against anti-Medicaid legislation that we encountered. So a little bit of context about our legislature. Utah has a part-time legislature, and the legislature is in session from mid-January until the very first Friday of in March. And that is that's actually exactly 45 days. And that includes weekends, believe it or not. So as you can imagine, things move rather quickly. On average, there are a little over 1,000 bills that are proposed, and approximately changes year to year, but on average, half become laws. And then after the general session, we have what's called interim sessions for the rest of the year starting from May until the end of December. And this is when legislators come to the legislature once a month. They meet in their respective committees. They study key issues and other policy items more in depth. And they, if they choose, they can develop different policy drafts and bills in preparation for the next legislative session. So during the 2024 session, we saw a lot of disturbing themes emerging around Medicaid, similar themes that have emerged throughout the country as well. A lot of our legislators have this belief and fear that the federal government will eventually run out of funding, that states are going to have to pick up the slack, that we're not going to have enough funding. So a lot of these fears was really prevalent during the session. And we saw a number of bills that came out of those fears, those misinformed fears. Several of these bills that surfaced were within the theme of contingency planning, adding additional stress testing. But one in particular that posed the most immediate threat was House Bill 463, Medicaid funding amendments. I won't get too into the weeds and the technical aspects of HB 463, but always happy to share a link to that bill if you so desire to read that. But nonetheless, I want to provide some context on the bill and the intent behind it and the potential impacts that many of us were worried about. So the bill essentially aimed to redefine what qualifies as a Medicaid shortfall. And if these requirements were met, it would have given the legislature authority to implement drastic measures and cuts to the Medicaid program, like freezing Medicaid hiring, suspending salary increases, stopping provider reimbursement rates, and most concerning, which was canceling coverage for optional services and other Medicaid programs. Of course, when we talk about optional services, though it's a federal Medicaid definition, we know that these services are nonetheless essential, critical, and often life-saving to many of our beneficiaries on Medicaid. So some examples of what was on the chopping block had this bill passed are things like prescription drugs, autism coverage, behavioral health services, home and community-based services, our targeted adult Medicaid program, which is for adults who earn up to 5% of the federal poverty level. So folks who are very vulnerable, folks who are experiencing homelessness, who are in the criminal justice system, who are getting treatment for substance abuse and mental health. And so many of these and these programs and many others were at risk of being gutted. And so the bill, of course, this would have targeted many folks in the disability community, those in the rural areas, and children, of course, as they make up a little over half of our Medicaid population. So it really was just this all-out attack on the very fabric of our healthcare system, and the stakes just couldn't have been higher in that moment. If the bill would have passed, it would have also closed enrollment to new Medicaid members, and again, ended coverage for many of these critical services without any plan to reinstate them had this definition been met. So I want to talk about what we did in response. This was new to me. Like I said, I joined Voices a little over a year ago. So this was a very new experience for me, being on the defensive side. So I learned so much and continue to learn a lot from these amazing advocates that I have the pleasure of working with. And so our approach to combating HB 463 really was multifaceted and relied heavily, again, on the strength of our coalition and our community. We knew that one of the most important things to do was to educate our legislators, many of whom really didn't understand the nuances of Medicaid and the way that it's funded and how important and valuable it really was to their constituents. We were able to leverage the relationships that many of the advocates in the coalition and many of us had built over the years with longstanding Republican legislators who had experience within the healthcare policy, many of whom these lawmakers were very instrumental in creating the new Medicaid programs in the past, like TAM, that were under threat under this bill. And so many of these legislators were very helpful, were willing to talk to us. We were able to share data. They were really great during committee and sharing some of this data and speaking to other legislators, which, by the way, the bill actually went into the Business and Labor Committee, not Health and Human Services. It was a mess. So we were able to provide legislators, those who were opposed to the bill and those who maybe were kind of unsure, we were able to talk to them and approach them with some data-driven explanations of what HB 463 would mean to the community. We educated them about the FMAP and what that meant and how the funding structure works, because it's very complex, it's very confusing. And not to say I'm an expert on all of that, but we relied a lot on our advocates who have so much of this knowledge. We relied on technical assistants and other folks who were able to help us with some of this messaging and strategy behind having these conversations. And so the other thing that we also relied on was on our advocacy days on the Hill. And this is really critical. And we held 4 different events on key Wednesdays throughout the legislative session, where we invited community members, healthcare providers, and other members of our coalition and other community-based organizations to come together, come to the legislature with us and meet with their elected officials. And this was moments for them to share about their experience with Medicaid, whether it was personal or their patients' experiences. And I remember one particular conversation that a constituent had with their legislator, and they shared their experience of having an autistic family member. They were really able to relate on that. And we talked about, you know, if this bill passed, then a lot of the coverage for kiddos who are on autism or adults, like that would have been gone. And so that connection actually ultimately secured a no from him on the bill. And so personal stories like that, you know, personal stories, real experiences matter just as much, if not more, than some of the technical arguments at times. And then we knew we had to reach to rural legislators. This is where we were able to utilize some materials from the Center for Children and Families that revealed, and it's right here on the slide here, and it showed Medicaid and CHIP enrollment by county. And so these were utilized when we spoke to many of our rural legislators and explained to them, the impact that Medicaid has for rural families and rural children, especially those who benefit from home and community-based services. And so reaching rural legislators was crucial to really show how devastating HB 463 would be to their own constituents. So thanks to this collective effort, many long nights, HB 463 never made it to a vote on the House floor. We were able to effectively kill it. And really, this was largely due to the incredible leadership of the small but robust coalition, and who really worked tirelessly to keep up the momentum. So at the end of all of this, we wrote thank you notes, and we had little lifesaver gummies, and we gave them out to all the legislators who were supportive. And within all this, we kept an Excel sheet where we kept track of those yes, no, maybe votes. And this will be very helpful for us in the upcoming session. So really, at its core, the bill just reflected a very deep misunderstanding about Medicaid, and it had a lot of lack of compassion for the people who rely on it. But through educating legislators, engaging our community, and leveraging some of those relationships that we had built, we were able to stop it on its tracks. Next slide, please. Thank you. So I wanted to talk a little bit more about, preparing for the 2025 legislative session. Even though we celebrated a major victory with the defeat of HB 463, we do know that the fight isn't over. The bill is expected to come back, and we anticipate it will be a study item during this interim session. This presents its own set of challenges because interim committees have the ability, again, as I said earlier, to draft bills and even hold preliminary votes, which means it gains traction in the interim. And so these bills can move through the legislative process more smoothly and quicker once the session begins. And so we're preparing, we're keeping a close eye on it, and monitoring the interim, and preparing to talk to legislators if we need to. One of the things that, we really got out from this session, and its connection to our 100% Kids Coverage Coalition, is the importance of strengthening and protecting Medicaid and CHIP. This is a new pillar that we added to the coalition. We knew, while we can fight for new policies and improve our Medicaid program, if we don't secure the stability of the foundational programs we have already, everything else can fall apart. And so we knew that it was important for us to add this new pillar of strengthening and protecting our Medicaid and CHIP program. So what are we doing now in terms of preparation for the next session? One of the things we are working on, that I'm working on, is developing engaging educational materials. So one-pagers, blogs, social media content that can both educate the public and legislators about Medicaid and CHIP. One thing that we noticed during this past session is that many legislators don't really have the right information. Medicaid is a very complex system, and without a deep understanding of how the funding works, it's easy to misunderstand some key aspects. For example, the word FMAP was utilized a lot during the session, and it wasn't oftentimes utilized in the correct context. We know that a decrease in the FMAP means it was oftentimes viewed as a negative sign by some legislators, but we know that a reduction in FMAP is generally linked to positive economic trends. And so little things like that, right? It was clear that some folks weren't aware, which is okay. We don't expect everyone to be experts on Medicaid funding and Medicaid itself. But we're working on trying to find ways that we can create easy to understand materials that we can utilize throughout the session and beyond about the way that Medicaid works, the way it's funded, the current programs we have, and the impact, right? Second, we'll continue to amplify voices through storytelling and honor those who share their stories. We've seen the power that lived experiences hold when it comes to changing hearts and minds, and by highlighting, uplifting, and honoring the stories of individuals who have directly benefited from Medicaid and CHIP, I think we can demonstrate that real human impact of these programs. These aren't just abstract policy debates. These are real people whose lives are at stakes, and we know that their stories and meeting with them in person or over email or over the phone can really help legislators connect with the issue on a different and more personal level. And then finally, we're focused on tapping into the strength of our 100% Kids Coverage Coalition. Our community organizations, our members, and other agency partners really are crucial in this fight. And we'll continue to be organizing advocacy days on the Hill, where we can ensure that we have a diverse range of voices from across the state that can come and speak to legislators and advocate in the ways that they're able to. Next slide, please. Thank you. Now, while our efforts during the legislative session were critical in blocking bills like HB 463, our advocacy doesn't stop at the legislature. And really the strength of our coalition lies in our ability to not only navigate some policy, but also mobilize the community in meaningful ways outside of the session. So with that in mind, I want to shift a little bit more on the ways that we've been engaging communities over the past year. In terms of building capacity to advocate for change and ensuring that their voices continue to shape the policies that affect their well-being and health. So I'd like to share a little bit more of the details, right, of what we've done this past year. So when it comes to community engagement events, we are really committed to fostering meaningful and impactful community engagement that goes beyond traditional approaches like health fairs and resource booths. In many of the different Medicaid community event engagement events we've held, our goal really is to be able to create lasting change by empowering community members, advocating for their needs, and building long-term capacity. Our approach really is guided by different principles of community empowerment, advocacy, capacity building that are all aimed at helping individuals take charge of their access to care and community involvement, as well as being connected and learning more of the resources that exist in their own community. So you can see here on this slide, the little bees represent all the different events we've held in the different parts of Utah, and we really tried to go throughout the state. Oftentimes, many of the events and momentum happens in Salt Lake County, which is the middle B, and oftentimes rural communities can be overlooked. So we're really trying our efforts to expand and connect with communities and meet communities where they're at. And so today we've had three events with the fourth one currently in the works in San Juan County, which is the bottom right county. As I've said, each event really has an opportunity to meet communities where there are, but I want to highlight one event that we held earlier this year in May. This was our St. George event located in Washington County, which is the southwestern corner of Utah. This event was slightly different because we included two panels specifically designed to foster civic engagement among community members and community-based organizations. And we invited representatives from CBOs in that region to come and join us as well. So the St. George event focused more on, again, like I said, enhancing that civic engagement while also addressing the social service needs of Southern Utah. And so we had resource tables at the event as well. We were joined by State Medicaid Director, who's actually been part of all of our events thus far. We also invited three influential local legislators who engaged directly with community members and organizations. The panels that we had focused on critical issues such as Medicaid, mental and behavioral health services for children with disabilities, and just broader civic engagement topics and how folks can get civically involved. And it really was just a powerful opportunity for community members to voice their concerns and provide direct feedbacks to policy makers and Medicaid officials who are responsible for shaping those services. Next slide, please. So what is next? As we look to the future, I think it's really crucial to remember that change is possible, even in a supermajority state like ours. Progress can feel slow at times, but we've seen that there are ways to bring both sides of the aisle and work together on improving healthcare access and health outcomes for everyone. So one of the things that we are working on for the next couple years and our commitments includes investing, enhancing, simplifying, and unlocking. So investing in community-based organizations. Our community partners and enrollment assisters are really on the front lines of Medicaid and CHIP enrollment and renewals. They know the community best. They know the unique challenges that their communities face and are really best positioned to assist eligible members with navigating these oftentimes complex processes. That's why it's so essential that we invest in these organizations by providing the funding that they need for intentional outreach and education, especially in geographic areas where there are higher rates of uninsured children. This isn't just about expanding Medicaid or CHIP enrollment, but really it's also about ensuring that those who are eligible can access the services that they're entitled to. Secondly, enhance language access. Another critical area of our focus is language access. Utah's growing diversity means that we really need to establish stronger translation and interpretation standards across state departments, like Health and Human Services and Workforce Services. So we're pushing for policies and helping just monitor that our agencies are up to date on the different policies that are coming out of CMS, and that they are ensuring that folks who need translation services and language access services are obtaining that as well. Third, simplifying the application and renewal procedures. One of the biggest challenges families face in Utah and really across the nation is the complexity of Medicaid and CHIP applications and renewals. So we really want to work in terms of simplifying these procedures, reducing unnecessary administrative burdens and barriers. For instance, during the Medicaid unwinding, we saw a lot of success with ex parte renewals. And so trying to figure out different systems that we can put into place that make application of renewal procedures easier, especially different notices that folks receive, and making sure that it's clear and just easier to navigate and understand. And then lastly, unlocking opportunities for expanding coverage. We'll continue to unlock opportunities that expand coverage to other groups. One of the things that we're excited about is working towards multi-year continuous coverage for kiddos and eliminating bars for pregnant immigrant women who are legal permanent residents. And so, amidst of enhancing and bettering our Medicaid and CHIP system, looking for other ways that we can ensure more communities have access to coverage. Next slide, please. Just for closing, I think there's a lot of moments where maybe our immediate focus is going to be on defending policy attacks, but that doesn't mean and stop us necessarily from pursuing long-term goals. It can be hard in supermajority states, but understanding that good policy takes time. It takes a lot of time, as we saw with our Cover All Kids bill. It takes compromise in some situations. And I know that's easier said than done, but knowing when to adjust strategy when needed, knowing how to leverage partnerships and relationships is really, I think, key. So with that, I do want to share, I think Syriac added it in the chat here. If you'd like to learn more about the work that we've done these past 5-6 years, we did just publish a new report, the State of Kids Coverage Report, that will outline the information we shared today with a little more in depth of the other policies that we've been able to pass and work on these past couple of years. And so we've added that here in the chat. Feel free to skim over it, look at it. If you have any questions, feel free to contact Syriac or myself, and that is on the next slide as well. And we'll make sure to add that information in the follow-up email that I'm sure Hannah will send. That is all from me. Thank you so much.
Thank y'all so much. I feel like the timing of having y'all come is just one that's really special. Knowing in North Carolina that we are a supermajority red state, we're going into an election year. Your insights are really helpful because we're in a new transition time with EarlyWell as well. We've broken into policy and community engagement, and knowing that y'all are further ahead and have had these successes, I'm really excited to regroup with everyone after to see what parts of this can we reflect in our own coalition. So thank y'all so much. We are going to pause the recording now if folks have any questions, just in terms of anything advocacy related.